my name is Harold Henry. I'm Director of Maternal Fetal Medicine at the Kaiser Permanente facility in Bellflower. And Nadia Suleman came to me in the first trimester of her pregnancy. She was a routine Kaiser member. And because of the nature of my practice, I'm pretty much exclusively, my practice is exclusively high-risk pregnancies. And by the very nature that she was carrying what we thought were 7 babies, naturally she fell under my jurisdiction. So ultimately she ended up being hospitalized because of severe back pain. And we encountered some choppy waters along the way, which ultimately led us to the point of delivery. And so while there's been a lot of focus on the delivery process, that was the destination. And in OB, delivery is always the destination. The marvelousness for me was not the destination, but the journey. All of the pitfalls that potentially could have happened did not happen. So we were very, very fortunate in that sense. And to me, the significance of the process is that if you look historically, there have only been 8 recorded cases in the world of octuplet pregnancies. Yes. And so 4 of the pregnancies ended in demise of all the babies. One, there were 2 survivals, another where there were 6, and then the last octuplets, which were actually born in Houston to an African couple. All babies were born alive initially, but the smallest one ultimately died, leaving 7. The significance for the birth, for the pregnancy that I took care of, is that this is the first in history in which all babies survived to a point that they actually were able to leave the hospital. And actually the expectation is very good for their growth and development. Pretty much the patient is on the go quite a bit, and so because of her celebrity status, we don't interact very much at this point. But yes, the babies do continue to come to the hospital for follow-up. I am somewhat distressed in terms of her behavior. I'm distressed at the fact that an infertility doc actually did this. And so it's a little troubling in terms of how this whole process evolved to the point that I got involved. But overall, I think the bottom line from my standpoint is that although we had nothing to do with the infertility aspect, my job was to help navigate the pregnancy to a point at which the kids hopefully would do well, and by all indications, they are in fact doing well at this point. People were really surprised to actually see that the 2 lead physicians were African American. 2, Dr. Karen Maples, who is chief of the Department of Obstetrics and Gynecology at the Bellflower facility. I'm director of the Maternal Fetal Medicine division in the same department. So, in fact, I think the expectations were quite different, and I think a lot of people were really surprised to see that there was an African American team that managed this pregnancy and brought it through to fruition. In point of fact, we are not the first team that have ever managed a historical birth. The first team was the team of African American women who brought forth the septuplets in Iowa 10 years ago. I think the septuplets are now approximately 10 years of age, but it was an African American team also at that point that was able to navigate that pregnancy to fruition. Remember that this is an extreme kind of occurrence, and probably will not happen again. Just by the sheer nature, the body was never designed to be able to carry that many babies. And to nurse that many, exactly. So I don't anticipate that that will ever occur again. And again, it was a very, very difficult pregnancy. We could have lost all the kids, some of the kids. We could have lost mom. And so if anyone is contemplating infertility, you want to be sure that your doctor does not put 8 eggs in or 7 that split. As a matter of fact, prior to the birth, we had made contact with KJLH with the thought that perhaps Kaiser Permanente would participate in this health forum. I thought it was a worthwhile venture, and I think there was a lot of good information that was being passed on, and certainly I think an organization such as Kaiser Permanente, a leader in the healthcare field, should be part of this process, and I'm glad to know that they are participating in a few of the breakout sessions there.